Patient confidentiality.
Confidentiality is one of the core duties of medical practice. It requires healthcare providers to keep a patient's personal health information private unless consent to release the information is provided by the patient. Patients routinely share personal information with healthcare providers. If the confidentiality of this information were not protected, trust in the physician-patient relationship would be diminished. Patients would be less likely to share sensitive information, which could negatively impact their care.
Data gathering.
Patient-generated health data (PGHD) can include an individual's medical history, current symptoms, biometric data, information about the lifestyle and more. This information is then submitted electronically to assist medical providers with diagnosis and treatment. By tapping into the desire of patients to be active participants, medical providers can shift responsibility for timely updates to the patient, as well as allowing patients to dictate what information they share. The use of PGHD can be invaluable in keeping providers informed about a patient's progress and status between in-person visits, and allow for a continual collection of health information. Certain data also can assist providers in determining and managing chronic care needs.
Demonstration on how data can be abused.
The patient data falls in the domain of confidentiality. The doctor-patient relationship establishes an implied contract of confidentiality, since the doctor is in a position to help the patient by collecting and analyzing otherwise private information. If the doctor asks a pharmacist to fill a prescription for a drug known to treat a serious form of cancer, for example, it would not be a breach of confidentiality. But if the doctor were to tell your boss that you are terminally ill, that most certainly would constitute a breach of their ethical duty to keep your information private.
If the patient data is semi-confidential, the third parties can access the patient's confidential information. For example, anyone can simply get the private data from the health institution or the medical practitioner without the patient's consent. Besides, hackers can breach the patient information by hacking the health institution's system. Corrective measures.
Currently, data has to be published under different circumstances for authorization, privacy and validation purposes. Besides, applying limited rights agreement between the patient and the doctor which could help in restricting confidential data to be shared by doctor in whole or in part, in any manner, and for any purpose whatsoever, and to have or authorize others to do so. Furthermore, to avoid published data to be abused through cyberspace, measures security threat database storage and enhance Solvit.
Conclusion. Technology has played a vital role in the advancement of medical knowledge, and as it continues to grow, so does the concern for confidentiality and privacy increases, given that medical providers gather anonymized patients' information. The medical health information from patients includes intimate details of their lives, therefore, portraying confidentiality and privacy allows patients to be more likely to seek health care, trusting that there are laws that forbid disclosure and that there are consequences for irregularities and breaching of confidentiality. Additionally, network security empowers patients by giving them the right to choose whether they want their information disclosed and the right for patients to know how their information will be used for medical advancement, thus creating a sense of altruism in patients who are willing to embrace the use of technology in the medical field.